Good afternoon, everyone. So I welcome you all to this session, which is organized by the KIMS Cuddles. I'm Dr. Parag Dekate. I'm Director of Pediatrics here at Cuddles KIMS Kondapur. And today we're going to have a very interesting session. So we are going to talk about, I would say, gastroenteritis as well as gastritis. Mainly, it's kind of a gastrointestinal dysfunction or diseases, what we see in the pediatric population. So we know that now we have a monsoon season all over India, and it's very common to have gastrointestinal diseases, which may be infectious or it might be related to some kind of abnormal food intake or unhygienic food intake, and that can lead to a lot of diseases in the kids. So we're going to talk briefly about a lot of issues related to this gastrointestinal system, and we'll talk about it one by one. Meanwhile, I would be taking a lot of questions which we get it through the social platform, and we'll try to answer those questions accordingly. So we know that when it is a monsoon season, actually it's kind of a very good season to have a lot of intestinal infection. The reason behind is a lot that unhygienic practices. We are not sure about the safe or hygienic nature of a water. And kids are also very prone to get infected because of not washing the hands, playing in the water outside, in the rainy water, and there are very high chances of contamination through the water supplies, which might be in the buildings or at the higher level from the support. So it actually gives a very good medium for the viruses and bacteria to thrive, which can give rise to a lot of infections. So what are the things which give rise to what kind of an infection we see in the monsoon season? Mainly it is, remember, any infection which is related to the gastrointestinal system has to come from the mouth. It might be related to you are putting a dirty hands in the mouth, the kids are putting a dirty hands in the mouth, or they are having an unhygienic or unsafe water, or I would say an unhygienic and unsafe food. So if you take care of all those things, very unlikely the kids will have any kind of a gastrointestinal issues or infection. So what we call mainly we see in this monsoon season is acute gastroenteritis. That means there is an infection of the intestine. Then we have a gastritis. Acute gastritis, it is related to the infection or inflammation of the stomach. We call it as a gastric or gastritis. Then we have other infection which can be serious, though we have a vaccine for that, but it can really cause a serious issues. We call it an enteric fever or typhoid fever. It itself is one another form of a gastroenteritis, but it's kind of a little bit more serious and severe kind of a disease. So these three are very, very important kind of a infection. And nowadays, because of the COVID, lot of COVID infection also we see gastrointestinal symptoms. So the research says almost 70% of the kids with COVID infection can have acute gastroenteritis, loose motions, gastritis, abdominal pain. So these are all very important symptoms with respect to the COVID also. Now, as we said that these are the three things which I wanted to discuss is acute gastroenteritis, gastritis, as well as enteric fever. So, which itself causes I would say, almost 70 to 80% of the infection in the kids. So let's talk about gastritis, which we see frequently. Most of the time, it is mildly symptomatic, get cured by itself. But a lot of times, I would say 50% of the time, kids comes to the hospital with a lot of varied symptoms. So what is gastritis? As I told, it's an inflammation or infection of the stomach. So usually kids will get nauseous feeling. They will have abdominal pain. They will have vomiting. They might have multiple time retching. They will say something is coming in the mouth, which is not kind of a really giving a good taste to them, and it might go on for 4 to 5 days, and if it is not taken care properly, they might persist and to have these symptoms for longer time. The major side effect of this is kids will stop eating because they have a really a bad taste, because of the retching, because of the abdominal pain. And most of the time the reason for this gastritis is, again, as I told you, eating an unhealthy or unhygienic food, probably water, and not washing the hands frequently. So those dirty hands, we try to eat something and we actually make it sure that this infection goes inside our stomach. So these are the symptoms. This most of the kids present, and the treatment is most of the time is very, very kind of a minute treatment, doesn't require any antibiotics because most of them are related to the unhygienic food or some viral infection. So we give some medication which takes care of the acidity of the stomach, medication to take care of the vomiting, and in a couple of days they usually improve. But sometimes again 20 to 30% of the kids, these things can go on persisting, or sometimes this can change into what we call the acute gastroenteritis, or sometimes it could be an early feature of acute gastroenteritis. So what is acute gastroenteritis is, it's an infection of the intestine. So how it present? So apart from the symptoms of gastritis, which means abdominal pain, vomiting, nausea, not having a good taste, additional symptoms what you see is in this is you started having a loose motion. Remember that you're not going to have a frank loose motion in the initial part of the disease. Usually what happens is they get 2 to 3 kind of loose motions which are not really watery, and if they remain unnoticed or untreated, probably over the time they started having a very increased quantity of loose motions or completely watery motions. And if again we don't take care of them, they present in a very bad situation. We call it a dehydration. So remember, acute gastroenteritis again has to come from the mouth. Again, unhygienic food, unhygienic water, or not having proper hand washing, or not following a complete sanitization can give rise to this acute gastroenteritis. And as I told about the symptomatology, the most important thing in all those kind of a thing is to avoid or to prevent the infection. So how we going to prevent this infection is, again, what you have to do, you have to make it sure kids are washing their hands once they're back home, make it sure they are taking hand sanitizer properly, then make it sure that they are having an access to a safe and hygienic water. This could be at home, or this could be in the playing area. So always carry a water bottle, or probably a bottle with taken care of a good water supply. Then third thing is food. So make it sure that you are not exposing your kids to the outside food or the food from the outside vendors. Avoid the food from the hotels, or if you are really sure about the hygienic practices any hotel follows, so you can try food from that hotel, but I would ask you to refrain from ordering from outside, specifically the roadside food. And avoid spicy food, because spicy food itself can promote gastritis, and it can give rise to early viral gastritis, and it can promote again infection, and you can go rise to the acute gastroenteritis. So these are the few things you can practice. And remember, once you have acute gastroenteritis, the most important thing remains is the hydration and hydration. So remember, 90% of these kids who get acute gastroenteritis doesn't require any hospitalization. What you can do is you can really make it sure that their hydration is well maintained. Sometimes it is difficult because they have a lot of nausea, abdominal pain, or sometimes they don't like the taste of ORS, so they don't take a good amount of ORS. But make it sure that hydration is maintained. So what other things which we can use for hydration are, I would say, ORS. Again, a WHO approved ORS. There are a lot of different flavored ORS available. I would say they are not recommended, but sometimes they can be harmful because they have a different concentration of sodium, glucose, and sometimes it can give rise to fall in the sodium level of the body or rise in the sodium level of the body. So make it sure you are following a WHO approved ORS solution, or sometimes we call it an electrolyte solution. So second thing which is very important is you have to make it very appropriately. That means it will be written on the sachet that one sachet to be dissolved in a 1 liter of water. So don't try to make it like I would just take some quantity of ORS and put it in a 1 glass of water, because you can actually alter the concentration of ORS and it is not good for the kids. So you follow a standard dilutional precautions or standard given by the WHO. Again, whenever and now the ORS week is also going on, so all over the world we are promoting ORS. Remember, this is one of the invention happened in the last decade which has saved maximum life. So ORS is kind of a, I would say, a discovery which has saved millions of kids from dying. You might take it from Ebola in South Africa. What you have again, hydration and ORS has saved millions of lives. So how to give it? So remember, whenever your child is passing a good quantity of big motion, make it sure that you are giving approximately 10 ml per kilo. So that means let it be a child weight is approximately 10 kg, and he passes a big amount of a motion. Make it sure you are replacing it this with 100 ml of ORS whenever he passes a motion. This is in addition to whatever food or normal intake of a solution or solute or liquids you are giving to the kids. You add an extra of 10 ml per kilo for every motion. And if the child is passing kind of a small motion, what you can say is approximately 5 ml per kilo. So for a 10 kg child, approximately 50 ml. So you keep on hydrating this. Remember, the kids will not come to hospital or not get into the hospital just because of the loose motion. They get admitted because of the loss of hydration, or they get dehydrated, and that is the reason they get admitted. So what are kind of a danger signs when we see, when we are talking about acute gastroenteritis? So high spiking fever going on. Sometimes you can have a dysentery. What is dysentery is? Dysentery is again a form of acute gastroenteritis, but it is mainly bacterial. So how they present differently? So they get a lot of mucus into the motion. They get a blood into the motion. So whenever you have a blood in the motion, again, it's a danger sign. It's a dysentery, not a viral gastritis. So decrease, increased frequency of motion, like within a couple of hours, you pass 7-8 times, watery motions, poor oral intake, the child is getting dehydrated, child is not able to pass the urine for 6 to 8 hours, and child is having any other neurological symptom, child is not looking well, very lethargic, continuously vomiting. These are the danger signs. You should immediately go and visit your doctor. But if they are passing 7 to 8 or 10 motions per day, but they are drinking like a champion, they are drinking ORS very nicely, you don't have to worry, because most of the time they are self-limiting and they usually don't cause any issue if you are maintaining the hydration well. So the most important thing in acute gastroenteritis is hydration, hydration, and hydration. So what different things we can use for hydration? As we talked about a WHO approved ORS, other thing is if they have a nausea or they are not accepting ORS, you can reasonably make a 1 glass, you can take a 1 glass of water, add 2 pint of salt and a 1 pint of a, 2 pint of a sugar and 1 pint of a salt, mix it, and that can also be given as a hydrating solution. Third thing is you can use coconut water. You can add a little bit of salt into the coconut water, which itself will give kind of a solute sodium. Coconut water is good source of potassium, so that can be used. Sometimes you can alternately use buttermilk with little bit of salt. So these are the commonly hydration solution we should use. Few of the other hydration solution is rice water, dal water. Again, make it sure that it is having a good amount of salt. A lot of time what happens, kid doesn't drink ORS, or they develop some kind of a nausea to ORS, and they are really thirsty, so they start drinking a lot of normal water. So make it sure that they are not drinking a lot of normal water if they are actually dehydrated, because normal water doesn't contain any electrolytes or solutes, and they can have, it can aggravate the issue by decreasing the sodium content of the body, decreasing the potassium content of the body, and it can be sometimes life threatening also if the child is really really dehydrated. So make it sure that you are giving a solution which has a good amount of electrolytes and a good amount of glucose. Having said that, a lot of parents ask whether I can give juices. So remember, excess of juices is not good, because in acute gastroenteritis already your intestine is inflamed. So if you drink a lot of juice, which is actually a very very high concentration of a sugar, you can give rise to a more diarrhea, what we call as osmotic diarrhea. So make it sure whenever you have an acute gastroenteritis or upset intestine, don't push too much of juices, or avoid excess of fruit juices, which is one of kind of a modality we usually tell parents about when we are talking diet in acute gastroenteritis. Now, what kind of a diet? So, as we understood what is acute gastroenteritis, what are oral rehydration solution, how to give it, when to give it, and how much to give it. So then is what about food? Whether we should, because a lot of parents says, okay, whatever the child is eating, he's passing motion. So probably it is possible that whatever food I'm giving is aggravating the diarrhea. So no. Remember that acute gastroenteritis or gastritis is kind of a stress on the body. So if you stop giving food to them, it might aggravate the symptoms or aggravate the disease process itself. So make it sure that you are giving a proper food to them. So what kind of food we can try or give when we have an acute gastritis or gastroenteritis? So few of the things which is very important is avoid again outside food, spicy food, and what other foods you can give? You can give khichdi, you can give curd rice. Again, we know curd is a very good source of a probiotic, which itself is a very, very important in acute gastroenteritis. Okay. What other things? You can decrease an excess of milk. So don't give excess of milk unless and otherwise is a breastfed infant. The reason for that is a lot of these kids who had an acute gastroenteritis, there are kind of a, you can say, small brush borders on the intestine. And during the gastroenteritis, you lose a lot of intestinal cell. And during this, you lose a lot of this hairy cells, we call it as, and it has an enzyme called lactase. So you lose a lot of lactase enzyme, and that's why you are not able to digest lactose. And in another way, we call it a secondary lactose intolerance. So in this situation, if you give them a lot of milk, which has a good amount of lactose, what will happen is it will draw a lot of water, because lactose itself is osmotic agent. It's like a sugar, and it will aggravate the diarrhea, and you keep on having a diarrhea. So more diarrhea, you are shredding more intestinal cell, and you are giving a milk, again you are giving lactose. So it's kind of a vicious cycle. So sometimes when you are actually having a chronic diarrhea or persistent diarrhea for longer duration, it is recommended to reduce the milk intake, or sometimes we ask them to replace the lactose containing milk with the non-lactose containing milk, so that it can help the intestine to heal. And this enzyme can take anything from 3 days to 3 weeks to come back. So you might see that your kid might have improved from acute gastroenteritis, but still passing kind of a loose motion for 3 4 days, and they are slowly come down to the normality. So the reason for this is secondary lactose intolerance. So I would recommend you to be sensitive about this also. But again, if it is a breastfeeding infant, probably don't stop the breast milk. Now, from 1st August to 8th August, we are celebrating the breastfeeding week. Also, it's very important for the newborns. So don't stop breastfeeding if you're seeing the diarrhea in the newborns, because that is the primary source of kind of energy as well as hydration for them. Then few other things you can try. As I told, you can try buttermilk, you can try rice water, you can try dal water, but make it sure that you're giving some semi-solid. So hydration is one part of the protocol for managing acute gastroenteritis. On top of that, you have to make it sure that there is a calorie-dense food is also going. So what is this? You can give a normal soft diet, which I said khichdi. You can have roti, chapati. A lot of parents ask me that whether we should give gluten-containing food when you have an acute gastroenteritis. Unless and otherwise your child is having a gluten allergy, you can reasonably give gluten-containing food during the acute gastroenteritis. So please don't stop any food when there is an acute gastroenteritis, just thinking that child might pass a lot of motion if you continue to give food. The other things which are important here is a lot of parents ask when we say is a chronic diarrhea or my child is persistent to have diarrhea. I'll come to this question. So chronic diarrhea is something when the loose motions are persisting more than kind of 14 days. So this is a condition where you should visit your primary pediatrician. You should go and discuss with them, because there are multiple reasons for chronic diarrhea. As I told you, it could be uh, persistent secondary lactose intolerance. Sometimes giving, I would say, a lot of antibiotics during this acute gastroenteritis can give rise to, uh, uh, again, secondary lactose kind of an intolerance. Or remember, in our intestine, there are really good bacteria which are very helpful to us to make our motion probably semi-solid. So these are, we call it as a probiotics organism which are present in our intestine. So when you get acute gastroenteritis, what happens is because of the inflammation or infection, this normal bacteria dies or they get sludged off. At the same point of time, if you start giving antibiotics, what happens is these antibiotics also start killing these normal bacteria. So we lose this good normal bacteria in our intestine. So this itself, if the child is getting repeated exposure to the antibiotics prescribed by doctors, what happens is all bacteria goes off, and then you can persistent to have this chronic diarrhea symptoms just because of the exposure to antibiotics. So make it sure that this is also one of the reasons for chronic diarrhea. Then you have some bad infections where you persistent to have a chronic diarrhea. You have inflammatory condition where your body is not properly working or your body is responding in a different way. Then you have cow milk protein allergy. There are a lot of kids who has an allergy to the milk protein that itself can give rise to the chronic diarrhea, and sometimes they can present as constipation also. So, but whenever you are seeing any child with the chronic diarrhea, persistent loose motion, dehydration, vomiting, decreased oral acceptance, you make it sure that you are visiting your primary pediatrician immediately, so that the things has been taken care of properly. So we talked about lactose intolerance. So in a grossly, I would say lactose intolerance is primary and secondary. Primary is very, very rare. That since birth you don't have that enzyme in your body. Very, very rare. Most of us are secondary lactose intolerant. So as I told you, there are cells on the intestine. There are some kind of a projection on the intestinal cells. On this, there lies an enzyme called lactase, which digests the lactose containing things. So most of our milk products are lactose containing. So what happens is, if this enzyme, because of the inflammation of the intestine, or probably because of the repeated motion you are passing, this intestinal cell gets sludged out and you lose that enzyme. So here in this situation, if you bombard your intestine with some kind of a milk, so what happens is the enzyme is not there, they are not able to digest this, and what happens is you keep on having more and more loose motions. And most of these kids, what happens is they have a frothy kind of a motion, and if you do some glucose estimation of the motion, it will be positive. What we called as a reducing substances will be positive, and they keep on having a motion. And a lot of kids, what happens, immediately they take any milk related products, they will have motion. So this is again called as a secondary lactose intolerance. And the treatment for this is, sometimes what we ask the parents to reduce the lactose containing food uh, or a milk. So ask them to stop sometimes if it is really troubling them. We replace that milk with non-lactose containing milk products. So there are different milk products available in the market. If you are able to stop for a few days till the intestinal cell heals, that will be recommended, and keep on giving the normal diet. Sometimes we supplement this with some probiotics which are available in the market. These are kind of a good bacteria. They go into the intestine, settle there, and kind of make a good environment in the intestine so that the intestinal cells come back. So these are the few things we do it in the lactose intolerance. And remember, for again newborns and infants who are dependent on breast milk, kindly consult your doctor before stopping a breast milk, because it's a good source of energy, nutrition to the kids. So don't make that decision by just stopping the breast milk. Uh, few other things what we see nowadays because of monsoon season is, I would say, enteric fever. Again, enteric fever is one of the I would say endemic things in Hyderabad. What do you mean by endemic thing is, most of the Hyderabad is commonly having this bacteria. Now we have vaccination for typhoid, but still there is a 30-40% chance that you can encounter the infection. Definitely vaccination prevents the serious form of enteric fever or typhoid. All those kids can present as abdominal pain, vomiting, loose motions, all those things, and they will persistent to have fever, and the fever will go on unless and otherwise you go to the doctor. So anyone who is having fever more than 2 days, blood in the motion, again, all the danger signs, they should visit the doctor to make it sure that the things are not worsening and things are not becoming bad. These are the few common things I would say mainly responsible or mainly important in gastroenteritis and gastritis. Over the time, we'll make it sure that whatever the questions are coming, we'll try to answer those questions. So, meanwhile, I'll just, in my OPD practice, we see a lot of parents coming and asking the questions related to the acute gastroenteritis. So, one of the common question is antibiotics, that whether we should take antibiotics or not. Or a lot of parents, what they do is, they might have the previous prescription of an acute gastroenteritis and they just start taking it. Remember, almost 80 to 90% of the acute gastroenteritis are viral, and they don't need any antibiotics. And as I told you, 90% of the kids doesn't need any admission also, unless and otherwise they are dehydrated or they are not hydrating like kind of a like a champion. How I usually tell the parents coming to my OPD is, even if they have a 50 motions in a day, but they are drinking like a champion, they are doing well, they are roaming around here and there. There is no blood in the motion, no vomiting. Probably most of the time they don't need admission. Another thing which comes as a part and parcel of loose motion is most of these kids get a perianal rash. The reason for the perianal rash is definitely motion is one of the reason, but a lot of times parents are also responsible. The reason is, when they are passing a lot of motion, a lot of parents start utilizing the wipes. So remember, you are rubbing a child bum who is kind of a 1 year, 2 years, very fragile skin with the wipes at least 10 to 15 times a day. Just think about wiping your face 10 to 15 times with the wipe. What will happen to your face? It will be red, broken, breaks will be there, skin breaks will be there. Same thing happens with their bum. So we are responsible for making it aggravated. So what I'll tell you, whenever you start seeing there are loose motions, so stop utilizing the wipes. Make it sure that there is a lukewarm water, not too hot, not too cold. Just rinse the bum with the water and dab with the cotton cloth. So you're just gonna do this kind of a movement, not rubbing, no rubbing at all. So that, and switch on the fan and let it dry naturally. Stop, and you can utilize the diapers. That's not a problem, but make it sure that you're frequently changing if it is kind of a wet enough. And third thing is, there are some barrier creams available if you really started having a red bum. So you have to make it sure that you are using their barrier creams. I would not recommend any barrier cream, but any barrier cream with the increased concentration of zinc oxide would be helpful. Stop utilizing, I would say, uh, uh, powders. You can use a coconut oil sometimes to help the skin for healing. But this is also second thing which is very very important. So another thing is, whenever we clean the motion, we clean it from back to the front. And but My recommendation would be, usually try to clean it from front side to the back side, because when we do it from the back side to the front, we carry infection towards kind of a urinal area, and there are high chances of having urinary tract infection also. So make it sure that you're cleaning from front side to the back side, and stop utilizing the wipes. Mainly water and cotton cloth would do a trick. And if it is becoming a red, you can use zinc oxide containing any barrier cream to prevent the further damage. Self medication, again, a strongly no against self medications. There are a lot of products available in the market. If you just go to the pharmacy and tell them I want probiotics, he might give you something wrong, or something wrong combination of a lot of other different bacteria. So make it sure before taking any medication you take a consultation from doctor. And remember that doesn't need that. If the child is not that much sick and you really wanted to consult them, there are a lot of online portals are available. You can go through the online portal, tell your problems, and you can get the appropriate prescription from the doctor. We here at Cuddles are already available online through the MFINE, so you can actually ping us for any online consultation. That would be supported well. Utilizing some medications. So let's talk about two vomiting medications. So commonly used medications which is over the counter available is Domstal and ondansetron. So I would again refrain all the viewers from using this medication or self-medicating the kids, because the doses, because the concentration, and the really it can cause a lot of trouble. A few things, when you have an acute gastroenteritis, a lot of parents try to give a Domstal syrup, which is not recommended in acute gastroenteritis, because itself it can aggravate the, though it can take care of the vomiting, but it can aggravate the loose motion. So kindly consult the doctor before self-medicating. What medications you can use at home when you are having a problem of a gastritis or gastroenteritis? I would say ORS, hydration, which is the most important thing. You can use paracetamol depending upon the weight, the dose changes. If the temperature crosses more than 100, and as I told you, some barrier creams and coconut water, and take care of the bum. Those are the few things I would recommend you can take care at home, but avoid the self medication, so that you are not coming to the doctor in a late phase, or probably when the damage is actually already done. See questions whenever, if you have any questions. Okay, please. One thing happens with the parents is, they, when the child is passing the loose motion, it is very difficult to understand when they have a full diaper, is it a urine or a motion. So a small trick you can do it at home is, you can take a small cotton ball and put it around the urinary area, because if that is also wet nicely and it is not stained like a motion, so most likely baby is passing urine. Remember, it's very important. The child should have a good hydration. And what are the signs of dehydration you can see in the kids is one of the things is they start passing less urine. Second thing is their tongue becomes dry, uh, and they feel a lot of thirsty. And the very late stages that they lose a skunt, turgor, eye becomes very sunken. These are the late signs. So the early sign, I would say, they start passing a less urine than the usual. Second thing is the mouth become more dry. They become thirsty. Again, if they are becoming thirsty, more and more thirsty, then that means they are getting dehydrated. Uh, I'm still waiting for the screen. Yeah. No, I'm not able to see the screen, sir. How long the child with? Okay, so I got this. So how long does child gastritis last? So gastritis is again self-limiting unless and otherwise it's caused a lot of vomiting. Most of the time by 3 to 5 days it settled down. If it is non-infectious or it is because of the viruses. But if it is because of some other reasons like it's a part and parcel of an acute gastroenteritis, it might last for longer time. But most of the time they subside by 3 to 5 days. So the next question is, what problems can gastritis cause? So remember, gastritis causes a lot of belching, so you can have an abdominal pain or heartburn. Then second thing is because they are vomiting a lot, they can get dehydrated. At the same point of time, because of the nausea and belching, they are not accepting orally, so they can get dehydrated. And if it is related to some bacteria or virus, it can prolong on to get it to the phase of an acute gastroenteritis and make the things more bad. So these are the few kind of a complication which is caused by gastritis. And I would say if the child is drinking but occasionally vomiting, having occasional abdominal pain, you can see at home. But if they are persistently vomiting within a couple of hours, vomited 3 4 times, they are not accepting, getting dehydrated or lethargic. So it is a time to go to the your pediatrician immediately. I am a gastritis and I have excess gas. Why? So look, there is no correlation of gastritis with the gas, but usually having a gas is kind of a natural thing in any of the body, including kids. Usually, this gas comes when you can say you can bombard with a lot of proteins or a lot of lactose containing things. So you can produce a little bit of more gas, and it is a quite common things to have a gas. But in adults and adult population, because of gastritis or there are some other different diseases, you can produce a lot of gas. So in that scenario, if you feel it's really uncomfortable, you can actually consult a physician for the medication which are mainly related to the gastritis. But in a kids, I would not recommend any medication if they are just producing a more gas, which is a part and parcel of their life because of the alteration in the food. And make it sure that you are having a healthy food. What it means by healthy food is again avoidance of a junk food, which is really important. And a portion of a food is having a salad and green leafy vegetables, which would actually make a trick rather than giving a more medications. Chronic gastritis, again, chronic gastritis itself is a different issue. Chronic gastritis is mainly related to the some inflammatory condition. That means your body is not responding properly. Some bad infection. There are few infection. Again, I would not like to tell their names because confusing. But infection can give rise to some gastritis, and you have to take a proper treatment of that. Sometimes for this chronic gastritis, we might have to put a kind of a microscope into the stomach and see what exactly is happening there, what kind of a gastritis we are dealing with. Sometimes we take a little bit of biopsies also. So chronic gastritis itself is a different issue, and mainly very occasionally it is related to the infection, but a lot of times in the kids it is related, less likely it is related to acute infection what we get in the monsoon season, but mainly it is related to the chronic infections, inflammatory situations. And in adults it's a completely different ball game. It might be related to your personality, anxiety, all other things. So are hiccups a symptom of anything? I'm facing this with my 5-year-old dog. So hiccups is again common things. Again, most of the time it is because of the irritation of a diaphragm. There is one nerve which is supplying the diaphragm, and a little bit of irritation of that can give rise to the hiccups. Again, if it is an occasional hiccup coming in between, probably a little bit of a different stimulation. If you remember, a lot of our elders says just tap on the back. So it is not like a treatment, but it's like a different stimulation which gives you give it to the diaphragm or the back muscles. So it changes the stimulus from to the diaphragm to the other side. You can give a little bit of water. Again, water what will do? It go into the stomach. Stomach distends, sends some kind of a different stimulus to the diaphragm. So it elevates hiccups. But if you're having a continuous hiccup, which is kind of interfering with your daily lifestyle, again it needs a treatment, but that treatment itself is not good. So very unlikely you'll have a pathological hiccup. Most of the time they're physiological hiccup, and transient hiccups, it doesn't require any treatment. So gastritis, yes, if it is not severe, you are having a little bit of nauseous symptoms, occasional vomiting, and otherwise the child is drinking and eating like a champion, they might be self-limiting and they will go by themselves. Occasionally, if the vomiting lasting more than 2 days, or they are vomiting 5-6 times in a couple of hours, they are getting dehydrated. These are the reasons that you have to visit to the doctor. Remember, in acute gastroenteritis and a gastritis, most of the time it is not the disease which is causing the problem, it is the complication of the disease. As I told you, dehydration is a complication, vomiting is a complication. So these are the conditions which will decide whether you need an admission or any medical attention rather than the disease per se. So does drinking water helps gastritis? A good question. So I would add a little bit of things. A lot of people feel if you have a gastritis, just drink a milk. No. So it doesn't help. The milk is cool. It is gonna do the things or do the trick. It's not like that. Gastritis is an inflammation. So drinking a lot of water might soothe it, because you are drinking a water, cold water or a normal temperature water. It might give us a little bit of kind of a comfort to the tummy, but it won't take care of a gastritis completely if it is pathological. You have to have some kind of a treatment for that. But if again, as I told you, it is not bothering you, a couple of vomitings and you are hydrating well, probably drinking water might soothe you a little bit. uh, Again, one thing comes with gastritis and gastroenteritis: hot and cold food. So a lot of parents says, "Oh, can we give egg? Is it hot? Can we give this? It's cold." But it's like coconut water causes cold, banana causes cold. So there is nothing like proven any of kind of, I would say, literature. But if you're allergic to something, that you know that my kid is allergic to banana, so don't give banana. Or my child is allergic to coconut water, don't give. But there is nothing like a hot and cold food. All foods, whatever is comfortable for the child, what is acceptable, affordable, available, kindly give that food and making sure that the kid is not getting dehydrated. So in just like an analogy, in the old days, what used to happen is you see a lot of pediatrician. I'm talk about 20, 25 years back. So to promote, because a lot of kid doesn't take water, so to promote water intake, what they used to do is they used to give that some kind of a little bit of oily food, because if you take a lot of oily food, it promotes thirst. So they used to use the side effect of oily food to promote drinking of water or hydrating solution. I'm not recommending that. I'm saying everybody has to develop their own mechanism how to keep your child hydrated. And sometimes you can use incentivized therapy to the child, that if you do this, I'm going to give a kind of a book or something like that, so that you are keep on hydrating them and they are not getting dehydrated. And most of the time, even if they require all those kids with gastritis or acute gastroenteritis need any medical attention or admission, the treatment remains very simple. Whatever the hydration, the child is not able to take it, we give it through the IV till the child start taking orally. So we promote, again, since first day, encourage oral intake, challenge them with the oral fluids or food, so that the hospitalization duration is less, and we can make it sure that they are discharged from the hospital as soon as possible. Very rarely, almost I would say 80 to 90% of the acute gastroenteritis, definitely acute gastritis doesn't need antibiotics, and 80 to 90% of the acute gastroenteritis are viral. They don't need kind of any antibacterial or antibiotic per se. Other question a lot of parents ask is the most common cause of viral diarrhea in Indian context is rotavirus. So a lot of parents say that we have already immunized our child with the rotavirus vaccine. So why they are having the rotavirus infection again and again? The reason for that is that rotavirus infection doesn't 100% give a protection for the rotaviruses. They provide 60 to 70% of the protection, but definitely it decreases the severity of the disease. That means if you would to have kind of a very bad disease with a lot of dehydration because of the rotavirus vaccine, you had a mild dehydration and a less kind of a problems rather than a more problems. Is lemon bad for gastritis? So again, as if you ask me, citrus food can give rise to a little bit of more acidity. I would not say it is really bad. So let it be, if you are taking a lemon water with a good hydrating electrolytes and all those things, it might be helpful to you. But if you are just taking lemon per se, lemon, so it might be bad. So remember, citrus food can cause a little bit of a gastritis, but if you take them as a hydrating solution, probably it might do a better kind of, it will do a good things to your body rather than a bad things. So I would say in appropriate quantity, it would be beneficial to your body and would not aggravate the gastritis. Good. So we'll wait for 2 minutes if we had any more questions, and probably then we'll close the session. So in the last 2 minutes, what I would tell is yes, monsoon season is kind of an invitation for a lot of gastritis and acute gastroenteritis infections. And yes, make it sure that you are taking care of a hand hygiene, you are giving a safe food and safe water to your child. Avoid the outside food or food from the roadside vendors. Make it sure that they are washing their hands nicely. Whenever they have a gastritis or gastroenteritis, make it sure that they are having a good hydration. Use WHO recommended ORS solution, sometimes coconut water or salt sugar water that can be used. And remember the danger signs: persistent fever spikes more than 2 days, lot of vomiting, decreased oral acceptance, dehydration, not passing within 6 to 8 hours, are having, they are becoming lethargic, serious abdominal pain, blood in the motion. These are all danger signs. Come to the hospital immediately. Yes, lactose intolerance is common, but it doesn't mean that you're going to stop milk upfront. You can reduce the milk, but if you are persistent to have a loose motion more than 14 days, make it sure that you visit a doctor immediately. Decrease your milk containing things. Don't avoid the home medications or counter over the counter medications. Only thing you can use is ORS and paracetamol. Avoid Domstal in acute gastroenteritis, it can aggravate the things. And primary lactose intolerance is very very rare. Meanwhile, we had one other question: what is the best medicine for gastritis? So a lot of times, again, as I told you, 50% of the time they get treated by themselves. But the medication what we use in acute gastroenteritis is one medicine to reduce the acidity of the stomach, uh, where we use a different formulation. And second medication is to reduce the nauseous sensation, because if we won't reduce the nauseous sensation, then they will not accept the food. So it's kind of a vicious cycle. So we have to break, reduce the acidity of the stomach, and second is decrease the nauseous sensation. Again, I'm not promoting and prescribing any medication over the social platform, so I would refrain myself from taking any name or a brand name. But these are the two types of a category of medication we use for gastritis. Again, 100% of them doesn't require any antibiotics. So thanks for attending this session. And if you have any questions, you can put it on the social network on our handle. Probably we'll try to answer this question as soon as possible. Thank you very much and have a